since the measures that we took on Monday, the British public have responded in a fantastic way. And we've seen a dramatic decline in the use of public transport, allowing public transport to be increasing the preserve of key workers. We've seen a decline in footfall, and people are, the overwhelming majority of the British people are, following the strong advice that has been given in order to protect our NHS. And of course, we will share that data with you. One of the features of today's briefing was the set of numbers that I and Simon shared with you. And of course, we will share figures, share data in a spirit of transparency so that people can see that we are doing everything that we can. But I'll hand over to Simon, first of all, to answer your question on the additional help and support that we can give the NHS.
I honestly believe that everybody across the NHS is doing everything that can possibly be done to ensure that we're able to best look after patients who need our care during this coronavirus pandemic. One of the points that I think has been particularly remarkable actually over the last several weeks is the way not only the NHS but all public services have come together. That's true for local councils, that's true for care homes, it's true for the voluntary sector. And across government, we have had the support of the Ministry of Defence, we've had the support of other parts of government helping us prepare in different communities. Because as Michael said a moment ago, we earlier this week wrote to up to 1.5 million people asking them to take special care given their background health conditions. And for them to be able to stay at home in that very self-contained way requires people who can help with shopping, who can help collect medicines from the pharmacy. That's an enormous team effort that the NHS by itself can't do, and we are getting that support.
I might just ask Jenny just to say a little bit about data, social distancing measures and the appropriateness of the steps that we take. Jenny.
Thank you. So I think, as we've said, we've been trying to be transparent with this, but very confident that at all stages the government has acted on the science. It is an unprecedented event, as I think we're all recognising, and there is some degree of uncertainty with this. So with some of the data, as you acquire the data and the steps go into place, actually your data changes. So the earlier conversation around when will the peak be, well, it depends how successful we are. So there is a bit of a moving agenda on some of the data, but absolutely clear that we have acted, we have looked at the modelling, we have taken those interventions in order, which we know will produce the biggest impact, and we have steadily implemented those. And the last ones, of course, in relation to strict social distancing and particularly the shielding of very, very clinically vulnerable people is an important step to time appropriately, not because, just least because of the risks of them with coronavirus, but because they have multi-morbidities, they have other problems, and they need a lot of social support. So in this country, we have timed them really carefully to ensure that those social support systems are around to maintain them through the period of isolation.
Thank you, Jenny. And I'll turn now to Hugo Guy from the I newspaper. Hugo.
Mr. Gove, it sounds like you and your cabinet colleagues are not going to be automatically tested for coronavirus, despite the fact that the Prime Minister and the Health Secretary have tested positive. Can you confirm that that's the case, that there's no plans to test all of you? And if so, explain exactly why. And can I ask, I think this is probably a question for Dr. Harries. We've heard a lot about the prospect of getting kits that can test for whether or not someone has ever had coronavirus. We're told that 3.5 million of those are on order. Can you clarify, have those kits already been manufactured? And if so, by whom have they been manufactured? What company is producing those? Thanks.
Well, thank you, Hugo. People are tested if they are symptomatic, and those members of the sort of central effort in helping to defeat the virus who do show symptoms are appropriately tested. But I think you can tell from the fact that the three of us are here demonstrates that there are three of us who have not yet demonstrated any symptoms. But it is important in order, as we mentioned earlier, to try to ensure that we slow the spread of the virus, that everyone, wherever possible, practices the appropriate social distancing disciplines that we've announced earlier. I'll hand over to Jenny and also to Simon just for a final word as well. Jenny.
So actually, I might just add to the points you've just made. So as I said earlier, we have very clear testing criteria. So we would not, in the early phase of the outbreak, we would have strong containment and contact tracing mechanisms. That is not appropriate at this point in the epidemic in the UK, but we will test appropriately for clinical management. The appropriate thing to do if you have symptoms is to self-isolate and remove yourself from the environment so you can't potentially transmit disease to anybody else. And that applies just as much to the cabinet members as it does to myself or any other part of the population. The only other criteria would be about the centrality of your role to COVID-19. And it's exactly why Simon has highlighted the importance of testing our workforce and other first responders as well, who are keeping the response going. In relation to the 3.5 million testing, the have you had it as opposed to the have you got it test, they are coming from a variety of different manufacturers, and I think, as Professor Whitty has said before, it is really critical that each of those ones is tested. We test the sensitivity and the specificity of the test, so how frequently we can pick up the disease, and then how sure we are that it's a true positive test. And each of the different types of those testing kits will be evaluated.
Thank you, Jenny. I'm going to leave the last word with Simon. Simon.
Well, I think it's simply to say that, unfortunately, pressure on the NHS is going to intensify over the coming weeks. There's no doubt about that, before things hopefully begin to improve. And so this is going to be a time when a lot of our frontline staff are going to be in highly stressful and pressurised circumstances. But I think what they would want me to say to the rest of the country is know this, that everybody is pulling out all of the stops to do the right thing. And if you can help too, by following the measures that have been set out, staying at home, you will save lives.
Thank you all very much. Thank you.